Jennifer, I must say you're looking younger today.
Yes.
How old do you think I look?
Okay, no, loaded question. Don't even answer.
Yeah,
It's a trap, Frank.
Yeah, you look 20.
Don't even do that.
Hey,
it's a trap.
thank you.
See?
My daughter knows how to answer that question. She will tell me I look 25. She will tell you I am 25.
Well, that's because you've told her you're 25. What are you doing today?
It's true. She's going to start to figure it out when she gets a little older and, you know.
When she's 25.
Maybe she's 27 and I'm still telling people I'm 25. We are spending the morning with Dr. Stephen Mulholland at SpaMedica, and we were talking about the latest and greatest in non-surgical procedures, including something called Voluma, which sort of, shall I say, inflates your face when it deflates.
Oh.
After it's... When you need a little, you know, need a little lift in your face. This is a non-surgical procedure. We're going to be showing it this morning on breakfast television. But you know what I always say, as you get a little older, you have to gain a little weight. That's good news for women because you want to have, you know, just a little bit more in your face.
All right, so, thank you, Jen. I look forward to that.
You know what happens to men when we gain too much weight?
No problem.
What's that?
We grow extra chins.
There you go. Trying to get rid of mine right now. We'll be back.
2, 1.
Good morning, everyone. We are at SpaMedica this morning, and we're going to be doing some non-surgical procedures this morning. I told you about one earlier on. We're also going to be doing, in the first segment, something called FaceTite. It's exactly the way it sounds. It's a procedure that tightens your face. And Kev, they have lots of things here for men as well. Men get the same things as women. Botox, hair transplants, whatever you want. We're at SpaMedica this morning, and we'll see you when we come back.
And we will be back at 6:54 on Breakfast Television.
Welcome back to Breakfast Television. It is 7:11. So Jenn Valentyne has been at the Live-Eye this morning, and she is at SpaMedica. So Jenn, this is what I want you to do. If Dr. Mulholland is there, I want you to tell him a big thank you for the Latisse. Latisse is something you put on your eyelashes, and it makes them grow. And I was skeptical, and I started using it, and you can't tell now because I have fake eyelashes over top. But if I took off the fake eyelashes, you would see how long my real eyelashes have become because of Latisse. I know you're there looking at a lot of non-invasive procedures, and they just get better every single year.
They really do. You know, Tracy, I'm going to tell Dr. Mulholland that in a minute, but there's lots of things that you can do just to give yourself a fresher look, like a photofacial or microdermabrasion, non-surgical procedures. But we're going to do one today. If you're a little bit queasy, you might want to turn. We're going to turn at one point. But come on over here. Let's talk about it first with Dr. Stephen Mulholland. Tracy Moore wants to thank you for Latisse, for that made her eyelashes grow. That really works.
It really does. Just topical application, 40% longer, 40% thicker. And so you can wake up with that doughy, glowy sort of eyelash.
Oh, very, very pretty. And you always look good. When you have longer eyelashes, it really does make a difference in your appearance.
Yeah, it's a very youthful thing to have long, lush eyelashes, for sure.
The procedure that we're doing today, this is Jane, by the way, a country karaoke singer. We've been chatting. What's your song of choice again?
Guitar's Cadillac by Dwight Yoakam.
We're going to have to get you to sing that on the show sometime. Loves karaoke. Woo! What's the procedure?
We're going to do what's called FaceTite, and it's a little device. This is what it looks like. And as we were talking earlier, this is like ironing your skin. So if you've lost weight or you've lost skin tone and you've exercised, you've dieted, you can't bring that tightness back after babies, after weight loss, just with age. This is like ironing your skin.
We're ironing those wrinkles away.
Exactly right. The internal electrode of FaceTite goes under your skin, so you have to have local anesthetic, like going to a dentist, and then we just go snap, 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 and without any cutting or any scars, you get tighter skin.
Okay, so we're going to turn the camera away when you enter the skin, just so people are a little bit queasy. So look over there, everyone. And what are we setting this to?
We're setting it to a specific temperature, so it constantly heats the temperature safely and effectively. So patients who do this procedure can literally go back to work the next day.
Okay, you know what? Let's take a look at the before and after while you do the entry. So this is a before picture right at the top here, and then right at the bottom, before is at the bottom, obviously, and then the after is right at the top. So this is the results that you can get with this procedure. Okay, you have entered the skin. What are you doing?
So what I'm doing right now is I'm slowly moving. Jane's in no pain. There's local anesthetic. And I'm basically applying heat under the skin. We've spent so many years developing techniques that heat on top of the skin. This is the first device that safely and effectively heats under the skin, which is far more efficient way to tighten. And so I move back across the area, and the heating tightens the collagen, tightens the elastin, the fibers that give our skin youth. And there's no bruising, no downtime. Patients generally go back to work the next day. And one treatment, it's not a series of treatments, a single treatment to bring back skin tightening and skin health. So the FaceTite's been very, very popular.
One treatment, you can go back to work that day, not very invasive at all. This is a new procedure that you've been doing for about 11 months now. So what have the results been like over the last 11 months? What have people told you? What have you seen?
Well, it's been great because I'm showing the neck here today, which is very common, but loose skin of the upper arm or of the upper tummy after babies, or of the inner thigh, or above the knee. Techniques and procedures where in the past, as plastic surgeons, we go, oh, we have nothing for you. Now we can tighten skin.
So you can do this under the arm too?
Yes, that loose, that sort of bat wing skin, you can tighten that. Anywhere where you have loose skin and you're really not interested in a real surgical procedure, this is a great opportunity for tightening under local anesthetic.
And it doesn't hurt?
Jane, what's it?
No, I don't feel anything.
She'll be singing karaoke tonight. We'll see you when we come back. Non-surgical procedures this morning at SpaMedica, Kev. Hey guys, thanks very much. Lots of fun in the lobby this morning. Today we are at SpaMedica, getting ready for the summer with non-surgical procedures with Dr. Stephen Mulholland. We are doing a procedure that is going to help us with the belly fat, but it will help us in other areas as well.
Yeah, this is called the TiteFX, and like the name implies, it gives you a tight effect. And it's a fat melter, fat of cellulite, fat of wiggly jiggly areas like the tummy, the pot, the saddlebags, the arms, inner thighs. Summer is coming, so tough to lose areas again with diet and exercise, but you don't want to do liposuction. This is the kind of technique that is very compelling for patients heading into summer with that troublesome area.
Yes, this is a troublesome area for a lot of women and men too. You can see a definite difference here. And is this the first procedure? Yeah,
this is Laurel's first procedure. You can see there's still the bulge on the other side. You get a flattening. The TiteFX emits a high voltage electrical current. It's very comfortable compared to other techniques, but it kills the fat cell in a safe way that your body can then metabolize it. So it's really very few contraindications. There's really no risks, and it's a series of treatments once a week for several weeks, and 3 or 4 centimeters would be the average reduction.
Okay, how much approximately a price range would something like this procedure cost you for this area?
When you look at the non-surgical treatments like TiteFX, generally they're less than half the cost of liposuction. So for a series of treatments on your tummy, it might cost you $1,500 to $2,000, or about what it costs for Jenny Craig or a Bernstein program, but you get to get a focal loss of contour. Like if you look at the before and afters here.
Yeah, and you always take before and afters always, when you do with your patients, and these ones have definitely, they've signed off. So let's take a look at this one, because there's a definite difference.
Again,
here.
Tummy, bra line, hip, very common areas. And clearly weight loss would be a component of that strategy for this patient, but if she tried everything and this was her weight, she'll feel much better in tight blouses or summer garments, summer wear. Same with this lady, a couple of kids, the tummy's a problem for her, and this is just a safe, non-surgical way to slim frustrating areas after weight loss, babies, and it's a tough thing to do on your own sometimes.
What does it feel like, Laura?
It feels like a mild electrical shock, but it's not. It's fairly comfortable.
Okay, good stuff. And we'll let you continue because we don't want you to be lopsided, just on one side and not the other. So we'll leave you to it. We don't want her to be lopsided, do we? Back to the station. Good morning. We are back at SpaMedica with Dr. Stephen Mulholland. We've been doing non-surgical procedures, getting us ready for the summer. Nobody wants surgery.
Yeah, you know, very few people are going to have a surgical procedure. The vast
Some people
majority,
will, but
some do.
Some don't need it.
Right, and you're absolutely right. You can nowadays with products like Juvederm Voluma and Botox and our photofacials, you can look 5 to 7 years younger forever without ever undergoing a scalpel-based procedure. It's kind of neat.
We were talking about weight loss, and when women or men lose weight when they get older, their face sort of sinks in. You should always be a little bit heavier, just because of your face. But we can do something non-surgical to plump up our face.
So as we age, you're right. Deflation from natural aging, or you exercise, you look great from the collarbone down, but gaunt and older from the collarbone up. So bringing back volume is one of the tenets of a youthful look and what we try to do in plastic surgery. The problem has been bruising. And so what I wanted to show today is this would be an example of a needle. We aren't going to do the injection, but you can see on the right would be the old-fashioned type of needle, which is sharp. And that would lead to bruising. Now we use these blunt tip microcannulas, and I can do lips, cheeks, inject anywhere on the face. And
what are you injecting?
Usually we're using products that are safe and reversible. One of the most popular right now is Juvederm Voluma. Voluma will last up to 2 years.
Wow, that's a long time.
It is a long time. But if you thought it was too much, you need to adjust it, you can reverse it or take it down a bit.
Lena's had stuff done on one side of her face. We can see it before and after here. What have you done with Lena?
Well, you can see that she's an exerciser. She keeps fit, and she was looking very hollow under the eyes, a bit tired, gaunt looking, and we injected a little bit of a Juvederm under the eyes, across the cheeks, subtle, but yet she looks rested, she looks fresh. And then you can match your face to your body if you happen to have lost weight or exercised your way into fitness and your face looks deflated.
And so what side are we looking at?
So if you look here, I injected about an hour ago her cheek and her lips. Now in the past, her lips would be horribly swollen. She'd have to take the day off work. But with the blunt microcannula technique, you can inject products in the face and makeup on. You could go right back to work.
There you go. Thank you so much, Dr. Stephen Mulholland at SpaMedica. Another procedure when we come back. Back to you.
Thank you so much. Good for you.
Thanks very much, Tracy. Good morning. We are back with Dr. Stephen Mulholland at SpaMedica, getting ready for the summer. Some non-surgical procedures. What are you doing right now, Dr. Mulholland?
I'm doing a procedure called the Fractora and the Firm. This uses tiny, tiny little microscopic needles and electrical current, and it creates little tiny pores and channels in the skin with the electrical current. And then I'll take some antioxidant type serum, and we'll put that on the skin. This is ferulic acid, which is a very good antioxidant. We're heading into summer, sun damage, brown spots, wrinkles. And then once it's on the skin, we'll take a device called the Firm. So the first one put little holes in the skin, microscopic.
Yes.
The second one actually moves in circles and pushes that product into the skin. So it penetrates, it opens up little pores, takes the skincare product, which is good unto its own, and pushes it deep into the dermis. The overall goal is tightening, firming, and wrinkle reduction, which is the Fractora Firm does. We did this side of her face already, and you can see it's a little pink, the cheek is full, there's a little ultrasound gel, but again, the type of procedure where makeup goes on, you can go back to work. It would be a series of treatments.
Really?
Yeah, once a week for about 4 or 5 weeks. And you can usually take 4 or 5 years off. You can see these
4 or 5 years.
Yeah, a year a week. So 4 or 5 weeks, 4 or 5 years.
Okay,
and again,
let's take a look. I really want to see some before and after.
So you can see this would be a lot of sun damage, fine lines and wrinkles, and the Fractora facial evens out those, evens out the wrinkles, firms the skin, and again, you can see the tremendous improvement in the quality of the skin.
Very nice. We got it over here as well.
And this individual over here, you can see the jawline, heavy jowls.
Yes.
And without any surgery, we can, and with the FaceTite we talked about earlier, still goes under the skin. This is a treatment on top of the skin to improve the contour and shape of the face and the appearance of fine lines and wrinkles.
Yeah, you can really get a closer look right here.
Yeah, tremendous texture improvement. So I would leave with this parting word. We're heading into summer.
Yes.
Stay out of the sun, and if you're going to be in the sun, wear a hat or wear sunblock, or you're going to need these treatments as well.
Okay, so that's really good advice. Wear a hat this summer, wear sunscreen. That is the most important thing that you can do for your skin. But there's always Dr. Mulholland. Thanks so much, Dr. Mulholland here at SpaMedica. For more information, just go to breakfasttelevision.ca and we'll have all the information. Back to the station.